my name is Grace.
Jeffrey.
Nice meeting you, Jeffrey. You're here for a physical. Good. We are going to do your physical from head to toe today, but we're going to examine the rectal and the private area. Okay? And while doing the physical, I'm touching you, I'm moving you. Please, if you feel any discomfort, let me know. Okay? I start from your skin. The skin is dark brown in color. There's no lesion. There's no pigmentation. There is no swelling. There is no marks. The lower extremities, there is no varicose vein and there is no edema. The skin temperature is warm to touch. It's not deformatic. And the skin is asymmetrical. Can I look at the fingers? The fingers are clean, rounded, and cut short. The nail beds adhere very firmly to the skin. Can you do to your back? The angle of the nails is 160. There's no sign of club. Okay. There's the toggle of the skin is good. That shows good hydration. We're going to look at your hair. The hair is dark in color. It looks cut short. There is no sign of alopecia, and there is no festation. The texture of the hair is soft to touch, no caustic. The scalp is movable, no cryptus, no tenderness, no lesion, no lumps. Good. We'll take a look at the head. The head is symmetrical at the center of the body. The head, there's no thick, there's no tremor. Gonna palpate the head. And we're gonna palpate for the nodes, okay? Ocular nodes, preocular nodes, occipital nodes, the tonsillar, the submandibular node, the mental node, the anterior cervical chain, deep cervical chain, the subclavicle chain. The nose, there is no nodule, there is no sign of calcification, and there is no swelling. Put a head up for me. The trachea is at the middle. The thyroid, there is no swelling on the thyroid. The swelling reflex is normal. Put a head down for me. I'm going to palpate your thyroid. Put your head this way. Put your head this way. The thyroid is, there's no tender, there's no nodules, there's no swelling. I'll listen to the thyroid. There's no brotal on the thyroid. Going back to the skin, your skin is also symmetrical. Alright? Good. So we're going back to palpate your jaw, I'm going to palpate your jaw, okay? I want you to open your jaw for me and move it side to side for me. Close it. Okay. The TMJ, there is no crepes, there is no tenderness, and there is no cracks. Okay, that's good. The face looks clean and the same color with the rest of the body. Palpate the paranasal and say the racular ground. I'm going to test the fifth cranial nerve, the trigeminal. Can you close your eyes for me and tell me if it's smooth touch or sharp?
Smooth. Sharp.
Okay, sorry. Sorry, did I push hard? I'm sorry. So we're going to do the face gymnastic. I'm going to test the seventh cranial nerve, that's the facial nerve. Okay, I want you to close the eyes for me. Try to open it. Try to open it. Okay, that's good. I want you to smile too for me. Puff your lips. Good. And I want you to frown. Good. And stick your tongue under your cheek on both sides. So that's good. Everything is normal. That's really good. So looking at your eyebrow. Your eyebrow is the same color with your hair and it's dark brown in color, and both the eyebrow is symmetrical. The eyelashes are also extended out. There is no flex and there is no discharge. The sclera is white. The iris is very clear. There is no droop, eye droop, or there is no eyelid drooping or swelling. The conjunctiva is clear and it's pink and its blood vessels could be seen. Okay, that's good. We're gonna move along. Bring it. Other test, so we go. Okay. I'm going to look at your cornea. Okay. The cornea is clear. So test the cornea with closed eyes. I want you to close these eyes and look at this. Look at the light with that eyes, and open your eyes. So the both corneas are equal, and they reflect to the light. So look at the pupil. So both people are reactive to light equally and accommodate the light equally also, and they constrict on the light refraction accommodation. So we're going to test the seventh. We're going to test the optic nerve. The optic nerve will be tested as the Snell and also the Roosevelt test. Those tests have been done. That is for short and long distance, and also we're gonna do the confrontational test. I want you to close one of your eyes for me and tell me when you see my fingers. Okay? See them?
Yeah. Yeah.
Okay.
Yeah.
Okay.
Yeah.
Good. So we're going to now do the third and the fourth and the sixth cranial nerve. That's oculotruncal and truncal and abducens. Okay. So I want you to follow. Look to this TV and follow the direction of this pen. Okay. That's good. That's completed that test. So we're gonna go ahead and take a look at your inner eyes. Okay? This test will be done on when the light is off, and I want you to look straight on the TV, okay? Okay, so I can see the rest reflex light. The optic disc is oval and is clear. Behind it, there is convert of the blood vessels. It's not ruptured. It's clear. Okay. So do you wear contact lens? Okay. You don't wear glasses too, right? Okay. So we're moving along, Jeffrey. So we're gonna go on. We're gonna go on with your ear. The two ears are asymmetrical. The helix of the ear is normal. The external, the counter of the ear, there is no discharge, there is no scar on the ear. So we're gonna take a look at the inner ear. And on this inner ear, we are doing the external inner drum is external ear canal is clear, there's no discharge. The internal ear, the tympanic membrane is clear. The pineals and the ear bone are all intact with the hair. There's no rupture. So I'm gonna do the 8th acoustic now. That's the hearing test. So tell me if you hear the sound, okay? Do you hear it?
Mm-hmm.
Okay? Tell me when it stops. It stop?
Not yet. No.
Okay. We just finished testing the website and the renal test. The AC and the BC, the AC is greater than the BC test. That is 2 to 1 ratio. I want you to close one of your ear. We're gonna do the whisper. Just repeat what I whisper to your ear, okay?
Jesus loves you. You are blessed.
Good. Thank you. So that is normal. So we're moving along. So we're gonna go on to your nose. The nose is symmetrical. The both septa looks intact, and we are going to test. Okay. So I'm gonna look at inside your nose. Okay. Let's put there. There is no discharge. The terminal is intact. The two septa are normal at the center. That's good. So we're gonna test now the first cranial nerve. That is the olfactory nerve. I want you to close one of your nostrils and smell. Tell me what you smell, okay?
Ginger.
Good. And close the opposite side.
Cinnamon.
Thank you. That's the first cranial nerve. So we're gonna take a look at. Before we continue, let me do your capillary refill of your nails. Okay. The capillary nail fill is less than 3 seconds. So I'm gonna take a look at your mouth and your inner mouth, okay? The lips are pink. That shows where there's no crack. That shows well hydrated. And can you open your mouth? Okay. Can you swallow for me? So on the mouth, I'm going to test the 9th and 10th and 12th cranial nerve. That's glossopharyngeal and the vagus and also the hypoglossal. That's 3 cranial nerve that controls the swallowing, the gargling flexes, and the tongue movement. I think I got a smaller pillow for me. Okay. So open your mouth for me. Okay. The teeth is clean. There's no cavities. There's no ruptures. Say ah. The uvula, the tonsils. Stick your tongue out. Move it from side to side. That's a hypofragile. Good. I want to put a hand. The hard palate is intact and continue to reach to the soft palate. Okay. Okay. So we're gonna continue and on your physical, we finish your eyes and we finish your nose and ear and the mouth. We did so we're going to continue right now on your thorax. Do you mind taking off your shirt for me?
Sure.
The thorax is concave in shape, and there is a hair distribution that is peculiar with men, and there is no pigmentation. I see the up and down respiratory movement. I'm gonna touch you, okay? There is no ridges. There is no tenderness, no swelling. Okay. So I'm gonna listen to your lungs, okay? I want you to put your hands over your head. Thank you. You can put your hand. The bones lung fields are clear. There's no rails, there's no crackle. So I'm going to measure the diaphragmatic percussion, the diaphragmatic exertion, okay? So I'm going to have you That's fine. You're fine. You're fine. I'm going to have you to take a deep breath and hold it. Sorry. So I'm going to do it again. Sorry. Hold it. Thank you. Exhale. You can breathe normally. Okay, so I'm going to have you to take a deep breath and breathe out and hold it. For resonant to the panic. Okay, so I'm going to measure it. It's 4.5, and this is normal. Thank you. We can breathe normally. Okay, I'm going to palpate. Just sit. You're okay. You're fine. You're doing very great. Okay. So I'm going to palpate the airpads. That's the PMI. There is no murmur. Good. I'm going to have you to lie down for me, please. That is good. I think you can come down a little bit so you can rest your head. Okay, good. So moving on the chest cavity. The chest cavity that's up and down respiration movement on the chest cavity. Okay. I'm going to listen to your chest. Okay. So we're going to start with the apex. That is the 5th intercostal space. Okay. The 5th intercostal space, that is the apex, and is the mitral area, and is at the left sternal border. We hear the S1 here. We're going on to the 4th intercostal space at the left sternum border. That's the tricuspid. The S1 is also hard. We're going on the 3rd intercostal space on the left sternal border. That is the abs. The S1 and S2 is equal. Going to the left, the 2nd intercostal space. That's the left sternal border. That is the pulmonic. The S2 is hard. The 2nd intercostal space on the right sternal border. That is the aortic. Here the S1, the S2 is hard. The S2 is higher than the S1 on the pulmonic and the aortic. So we auscultate also the carotid artery. The carotid artery is normal, and you look at it, there's no distinction on it also. So go ahead now and palpate the pulse site, the temporal, the carotid, the brachial, the radial pulse, popliteal pulse, pretibial pulse, and pedal dorsalis pulse. We're going on and go on the abdomen. The abdomen is flat, it's round, that is head distribution. There's also up and down respiratory movement on the abdomen. There is no sign of peristalsis. The umbilical is inverted, inverted inwards, and there is no discharge or any incident. So I'm going to go ahead now and auscultate the abdomen, the 4 quadrants. The 4 quadrants of the abdomen, there's good bowel sounds. I forgot to mention the femoral pulse. We couldn't do it. On the iliac, on the both iliac crest also, the iliac. And we're also going to auscultate the abdominal aorta. The abdominal aorta there's no growth in the abdominal aorta. So go ahead now and percuss the abdomen. I'll start percussing the liver. Awesome. So we're going to measure the liver. Measuring about 6. This is normal size of the liver. So across the rest and the liver, the spleen, sorry. To door. I hear the door sounds as a part of the spleen there. Could not able to palpate the rest of this of the spleen. So palpate the rest of the abdomen and this over the bladder is door sound. The normal sound we have tympanic. So we're going to now palpate the abdomen. I want you to take a deep breath and hold it. Time to palpate the liver. The liver is smooth, there is no tender. It's no, it's sharp. There's no sharp. It's smooth, rather. And the liver, sorry, the spleen. It's okay, you can breathe normal, that's fine. Unable to palpate the spleen, and that's what we expected. On palpation, there is no tenderness, there is no lump, there is no swelling. The iliac crest, the iliac are both there. There is no tenderness also. So we're going to go ahead now and palpate the right liver, the right kidney. Sorry. The right kidney is on the posterior iliac crest, posterior side of the abdomen. It's smooth. There is no tenderness. Are you doing okay? Good. So what we are going to do next is to do some movements of your hips and your legs to just check on the hip joints, okay? So I'm gonna help you. So just put it this way. This is abduction, adduction. This is like across your. This is external rotation, and this is internal rotation. I want you to lift your leg up for me. Flexion, and put it down. Extension. And try to lift your leg up. Okay, it's good. Try to pressure to strength and put it down. Okay. Okay, the strength on the lip. I want you to bend your knee. This is flexion of the knee, and this is extension of the knee. And try to flex the knee. I'm going to put some pressure. Okay, and the same thing, an extension. That's good. So I'm gonna have you to rotate your ankle. That's good. We're not gonna do that good. So let me do this for you. I want you to lift your toe towards your chest. This is plantar flexion, and toe towards down. This is dorsal flexion, and try to do the plantar. Okay, the strength. That's good. And downwards. Try to put downwards. That's good. So next we're gonna do the bend the knee. This is inversion, and this is eversion. Okay. I'm gonna have you to stand up for me. Okay. Stand up. Okay. So I want you to put any of their legs backwards. This is extension, hyper extension of the hips, and that's back. Okay. I want you to do what I do. Okay. We're gonna first of all shrug your shoulder for me. Good. Just shrug it up and down, up and down. That's good. And try to shrug it up. This is the 11th cranial nerve. Okay, that's fine. And I want you to bend your leg this way. Try to, don't let me to push it back. Bend, good. And this side, bend, good. And move, flexion, and extension, hyperflexion, and try to flex. Okay, try to go outward. No, that's good. And I want you to overhead and up. This is flexion, and this is extension, and towards the back, external rotation of the shoulder, internal rotation of the shoulder, and bend your elbow. This is flexion of the elbow and extension of the elbow, and try to flex it again. Try. Okay, no, and then try to flex it. Sorry, try to extend it. Put it down. Hold on. Okay, let's try get this again. Okay, okay, the strength down. Put it down. Put the hand down. Then try to extend your hands. Okay. Okay, that's good. I want you to stretch your hand up to me. It's a supination, not flexion. Okay, we go to your wrist. I want you to bend your wrist. This is flexion, extension, hyperextension. So don't let me press your ribs for you, okay? That's right, I will do this again. Good. So I'm gonna have you to rotate your wrist. Do this. Look at me. This is ulnar. No, look at me. Just ulnar radial flexion. Good. So your fingers. Stretch your fingers up. This is adduction. Put it together. Abduction. And don't let me open it. Try to open your fingers. Okay, so your fingers, try to bend them. No, do like this. Okay, this is flexion, extension, and hyperextension. I'm trying to pull you down, don't let me, and then downwards. Down, okay, that's good, and that is fine. So next thing we have to do, put your hand on your waist. I want you to turn side to side. Follow what I do. Okay. Bending of the hips. That's the trunk movement. Now I want you to do like this for me. Hyperextension of the trunk and back. So I want you to put your hand to your toe if you can. Okay. Check for sclerosis. Okay. You can stand up. That's good. So we're going to now rotate the trunk. See the rotation. I don't want you to move from the center where you are. Just have to rotate sideways. Good. Good. Any pain? Good. That's good. So, okay. The joint are smooth, no tenderness, no nodule. There is smooth movement with no restriction on the joints movement. Okay, so I'm going to have you to walk for me. So walk with your heel to your toe. Yes, that's good. Okay, do the same thing. Right now, during the neurological test. That's good. That's good. Then turn back to me. I want you to close your eyes. I'm doing the Rombach test. Okay? This is Rombach test. Okay, open your eyes. That's good. Stretch your hand this way and touch your nose. And I put it down. And I want you to close your eyes. stretch your hand and touch your nose. Okay, that's good. So I want you to sit down. Thank you. Okay, so I'm gonna do your reflexes. Okay, then we'll continue. That's good. Okay, let me have your hand. Just relax. It's not gonna hurt. Okay, this is the triceps. This is the biceps reflexes. This is the radial brachioradial reflexes. And what I want you to do for me there, put your hand this way, like you're pulling your fingers, and relax, okay? This is the patellar reflex, the ankle reflex. Okay, that's good. Okay, let's go. I'm gonna have to put your shirt on. Okay, so we'll continue with the tests and the neurological test. I want you to tell me where you hear this vibration and what part of your body. I would like for you to close your eyes, okay?
My left knee.
Did it stop?
Yes.
Okay.
My right knee.
Did it stop? Okay. That's good. Okay, that's your hand. So I'm gonna put an object on your palm. Tell me what I put on your hand. This is the stereotic test.
A coin.
Okay, that's good. I'm going to draw on your palm and tell me what I drew.
A 3.
Good. This is sonographic test. Okay. And open your eyes. Okay. This is neutral. This is neutral. This is bend, and this is tension. I want to